Hi, good afternoon, everybody. Thank you for joining us today. We're just going to give it another couple of minutes just to let people join, leave their last meetings and get ready for this one, run and get a cup of tea if they need it. Good afternoon. Welcome to our webinar today on navigating digital assurance for social care providers. We're just waiting for people to have time to join, so I'll probably give it one more minute and then we'll make a start, because there's a lot to get through today and we've got some great speakers for you all. Great. I think it looks we're sort of stabilized in terms of numbers, so probably time to make a start. So hi and welcome. My name is Katie Thorne. I'm the project lead for the Digital Care Hub, and really delighted to be running this webinar today, which we're able to do in partnership with the NHS Transformation Directorate. Just a little bit of housekeeping before we start. This webinar is being recorded, and we will send that recording to you either this evening or first thing tomorrow, dependent on how quickly my computer will upload the recording of this. All attendees are on mute and can't be seen, so please therefore use the chat to send messages, to introduce yourselves, to have a chat between us. If you have any questions though, we would ask that you please use the Q&A function. That's just to make sure that nothing is missed and we can get to all of your questions today. We will also send out all of the slides which you see today as well after the session. Got a bit of a jam-packed agenda today. So we're going to start off by hearing a little bit about somebody's lived experience with navigating the health and care system and the importance of data sharing to really contextualise why digital assurance is such an important topic. We will then move to Becky Hughes from the PRSB, who's going to talk about information standards and their importance. We'll have then Alison Taylor from the Transformation Directorate, who will be talking about the minimum operational data standards, specifically in the work that the Digitising Social Care team have been doing. And then we'll come to Taffy from the Casper board, explaining what it means from a software supplier's point of view to be implementing standards and how they're working to do that. Loads of time at the end for a Q&A. Please do keep your questions coming throughout. And if we do miss anything, we'll make sure to come back to you via email as well after the session. Just in case there's anybody who's joined today who doesn't know who we are as Digital Care Hub, we're a partnership project run by members of the Care Provider Alliance. We work really closely with the NHS England's Digitising Social Care team. We support care providers with free advice around adopting digital systems, data protection and cyber security. Next slide then, please. So without any further ado, I'd just like to pass over to Steph Nimmo to talk a little bit from her personal experience and contextualise this session. Thank you, Steph.
Thanks, Katie. So I am the Comms and Engagement Lead for NHS England's Digitising Social Care programme. And one of the reasons I was really drawn to the role is, like many people in our programme, I bring a lot of lived experience of the social care sector, and specifically around learning disability, and I continue to be very involved. And for me, this has really helped me understand what could potentially be quite a dry topic: data standards, interoperability, finding and making that actually live in terms of the difference that would have made to my own life is something that I try and do now in how we engage with the sector. And I wanted to share with you today, just very briefly, my own experience to sort of set the scene and to really, for us to understand why this is all happening and the difference it could make to people's lives. So could you just share the next slide, please, Steph? So this is my daughter Daisy's hospital notes. That was about, I think that was probably about volume 7 or 8 of a, yeah, I used to live in absolute fear that someone would accidentally drop them on the floor. And you could absolutely guarantee, like many of us probably had this experience, you go into the hospital, and she was frequently, my daughter had learning disability and very complex medical needs. I spent 12 years as her full-time carer. And often, you'd go to appointments and the notes weren't available, or they hadn't read the notes. So my role was to join it all together. And of course, like many people who have complexity, and young people with learning disability, my daughter was under various different settings. So we were under a tertiary care hospital, we had a local hospital, she had a continuing care package. We had 2 domiciliary care agencies trying to do her at-home care package, because she needed both medical care as well as personal care. She would go to a respite setting, and obviously we had the GP. And because she was school age, she had an EHCP. And remember, EHCPs last till someone's 25. So in adult services, nothing was joined up. The person who had to join up all of that care was me. So I would, everywhere I went, would carry around this little folder of notes to try and let people know what was going on, and to try and tell the story. And frequently I found I just wasn't able to just be there with my daughter who needed her mum. I had to be there telling everyone what was happening and join all the dots. And as probably no doubt you're all aware, this is a familiar story so many times for people across the sector. People either working in adult social care, trying to join up the dots, working with the most up-to-date information, sharing information, or people like myself who are carers, or people who are also receiving care. And my dear, dear friend Lucy would talk about this a huge amount. She had transitioned from children's services to adult services. She just had to become her own advocate. She knew she was life limited and had developed an end-of-life plan that she wanted everyone to read, and made sure it was available to everyone. But sadly, when she was at end of life, and she was really not able to articulate her feelings, the doctors didn't read that plan, and none of her wishes were supported. And for me, that's why at the end it's really important that we get it right, that we think about this information flow and joining up information and sharing information. Because I just think about my friend Lucy, and if only that information had been read and readily available, that she so passionately had inputted to and told people that this is what she wanted. So just wanted to kind of give that bit of context, which I imagine, and I've seen someone here from MenCap, to just remind us what potentially could feel on the surface to be quite a dry subject, what it actually means and the difference that that can make in people's lives. And I'm handing over to Rebecca.
Thank you, Steph. That was so, so helpful. And I think just really important to really think about the individuals who are impacted by sort of this lack of sharing every single day, who all of us, I'm sure, and everybody who's on this call can talk from personal experience about some of this. So thank you for bringing that. It's really kind. So now I'd like to introduce Becky Hughes from the Professional Records Standards Body, who's going to talk about information standards and why they're important, and also a little bit about the Professional Records Standards Body and what they do. Becky, over to you. Oh, you're just on mute.
I'm so sorry. I was going to be the first person to do that, wasn't I? I was talking away merrily to my dog. Thank you, Katie, for that introduction. And Steph, thank you so much, because you really have outlined for me why information standards are so important. So you've kind of done my job for me. So I'm really grateful. Katie, if you could pop the slide on for me, that would be great. So a little bit about who we are. Professional Records Standards Body, or the PRSB for ease. We've been established now for just over 10 years. We had our 10-year anniversary in September just gone. We're a not-for-profit and independent body, and I think the independence part is especially really important. So you know, back 10 years ago, the initiative was born out of the Department for Health and Care, and it was recognised then that the organisation needed to sit independently so that it could be the voice of its membership. And its membership is networks of professionals, patients, and of course, people. And lived experience is really, really important. And what we do is develop information record standards so that the right information is shared whenever and wherever care is accessed. And that very much speaks to the point that Steph was making. We need to be beyond this point of having you know, volumes and volumes of paper-based information. And the way to do things well and to best practice is to implement information standards to very much standardize that information. Next slide, please, Katie. To give you an overview of who we are, we're not a huge organisation, but at the very, very core of all that we do is our membership. And we have about 83 membership organisations now, and I think of a special relevance for us today. Care Providers Alliance are there, National Care Forum, CASPA, who of course Taffy's on the call with us today, Association of Directors of Adult Social Care Services, Care England, Digital Care Hub, obviously. And we're not just England based, we're UK. So we've got Digital Health and Care Scotland and Wales. And you'll guess from my accent, I'm actually Welsh, so always banging the drum for the devolved nations as well. We've got about 26 published standards, and they are fully endorsed as well. And when I talk about endorsement, it is all these organisations that you'll see here that work with us to develop those standards. We consult with them very, very closely, including people and their carers, and you'll see those patient representative bodies here as well. It's so important for us. I can't stress that more highly. And next slide, please, Katie. So a little bit of why we need information standards. You know, Steph's absolutely right in all that she says. It's really important where really good information standards exist. They need to be implemented across the IT solutions. So it's IT solutions who need to have the standards implemented, care settings. And if we do that, it literally joins up all of that information without somebody having to carry around that paper record. So all of the information is recorded in a consistent manner. It's available at the right place at the right time. So if you are unfortunately being admitted to emergency care from a care home, for example, your information goes with you. You don't have to keep repeating the same information over or hope that somebody at the other end has access to that information. When you get discharged back again, the updated patient record goes with you, so that there's a complete set of information about you, which is always available. Now, we are some way from that at the moment, but without information standards in, we won't get near to it. So the standards are so important. It's also true that with these information standards implemented, the information available can be tailored as well. So you might complete a complete person record in a care home setting, but actually if they are admitted to an emergency care setting, only a summary of that information might be needed. So all of that information can be tailored as well. And next slide, please, Katie. Thank you. And this slide is very much to give you an idea. Of course, the person's at the centre, but they might access services, you know, right around this kind of shared care record. All of the information needs to flow successfully there and back, so it's bidirectional. All the standards are aligned to ensure consistency and safe sharing of data as well, which I know is very, very important, that information governance side of things too. Next slide, please, Katie. I'm going to talk a little bit more about two really important standards that I think will be closest to the work that you're doing on a daily basis. The first one that you may well be aware of already is our About Me standard. It's the shortest of all of our standards, and it is meant to be implemented so that the person, where they have capacity, is able to complete this information themselves. And it's the information they want to be known about them. So it could be as simple as, for example, my birth name is Rebecca, but actually I like to be called Becky. You know, that is so you know, is so important. You'll all know this far better than I will even, you know, what somebody needs to be called, what name they'll respond to. If this standard is implemented, what you should see when you're opening your IT solution is these main headings. It might not necessarily be called About Me, but all of these headings need to be there in that record. It needs to be collecting this information in the same way in the back end of that solution, so that the information, as I say, can be shared across other systems and freely available. Now, the important thing with the About Me as well is not just that absolutely this is the person's wishes, but actually is that it's creating an auditable record as well. So as a person or their family or their care team wants to update their About Me, you see an audit trail of which is the most up-to-date record, so that, again, whoever's accessing that record absolutely knows that that is the most up-to-date information available, just in case that person's wishes have changed over time. But as I say, this is such a pivotal standard. I'm sure you're familiar with it already. If you're not, do have a look on our website, and the website's available for you to see use cases for the standard, lots of people's experience and the positivity around the standard as well. We're hoping at some point that this comes into the NHS app too, so it's shareable right across. And of course, a lot of you will already have access to patient-facing portals, so you'll be able to already see and update your own About Me. I have an About Me myself, and awful thousands and thousands of people already do as well, but I can't encourage you more to share the word about the About Me. Next slide, please, Katie. Another really important standard is our personalised care and support planning standard. All of you, I'm sure, are involved in one way or another in personalised care plans. This includes the About Me standard as well, but the information is there to be recorded by a professional caregiver. So all of that information, care and support plan, formulation, procedures and therapies, contingency plans and additional support plans are all covered off in the personalised care and support planning standard. This standard has something called an information standards notice as well, or an ISN, which means it's mandated to be implemented by providers in some environments of health and care services. And again, I can give you a website to give you more information on the mandation requirements for this standard. The cut-off date for this was January this year, so it has passed. But the key thing here is don't panic if you haven't done it already, because there's another way. You don't necessarily have to implement it locally yourselves. It might be that you've already selected an IT solution to be used, or you may already have one. And you'll find that by selecting some solutions off the assured suppliers list, which we'll talk about a little bit later, they will already have this standard implemented in their systems. So it's a really important one, as I say. Next slide, please, Katie. So I've just briefly talked about implementing standards and the assured suppliers list. Now, at PRSB, we provide all sorts of support for providers of health and care services, but also IT system suppliers, help to implement the standard within their systems. And then once they've done that, we actually provide conformance assessment testing as well. Now, the conformance side of things is really important, because anybody can say that they've implemented the standard, but really, where's the evidence? How do we know it has been implemented correctly to best benefit people and professionals accessing that information? Well, conformance is the way that that's done, conformance testing. It makes sure that the standard is fully tested in the system. It provides a purchaser of that IT solution confidence and trust that it has been implemented in the right way. And you get that consistency and the ability to share the information correctly, as I say. Okay, next slide, please, Katie. So I just want to give you an idea of some of the suppliers we already work with. Not all of these you'll be familiar with, some you will, most definitely. Some are on the assured suppliers list, some aren't yet. But it's we work with a lot of suppliers, I have to say, and a lot of them are going through the conformance process, which, as I say, makes it much easier for you to purchase solutions with confidence. Next slide, please, Katie. Little bit around the testing of conformance and what we do. As I say, it's really collaboratively, and it's meant to be on purpose. I think the worst thing we could do is have people just implement the standards without any support at all, and do it badly, and none of us will feel the benefits from doing that. So we work collaboratively, as I say, with providers as well as IT solutions suppliers to implement the standard. There's an element of self-assessment and evidence gathering that goes alongside that. Our assessors then carry out an expert review, including having a look at the system and having their evidence demonstrated. And then we provide a conformance statement as well. All of those conformance statements you'll find on our website under conformant partners, and you should see your IT system solution there already listed. If not, they are probably already going through the process. So do ask any questions about your system suppliers. Be happy to answer those for you. As I say, developmental discussion happens as part of this because it's really important that our standards stay relevant. So if somebody, a provider or a solution, is telling us that something has changed on the ground and part of the standard doesn't work anymore, we need to be aware of that and make sure that we're constantly updating those standards to make sure they stay relevant and they're used consistently. Next slide, please, Katie. Just a little bit here about some of the experiences so far of organisations going through the conformance assessment process with us. I won't read them. You'll have these slides afterwards, as Katie said, so please just have a look at them later on. Next slide, please. And I've touched on the digital social care records assured solutions list. It's really important. As I say, it's not just PRSB conformance that these solutions have gone through. It's really fundamentally changing the way that we do things in social care. These solutions have, been through processes that aren't necessarily easy, nor should they be necessarily. They've got the PRSB standards implemented, and I think I'll be corrected in a moment, but I think about 12 other capabilities as well. So it's really good stuff. If you're looking to purchase a solution, make sure you get it off this list. And I know there is funding available for that. I'm, again, not the expert on the funding side of things, but guys on this call certainly are. The results speak for themselves. Going through assurance has really impacted positively the digitising care records. There's no question about that. And actually healthcare are now most definitely looking at the care sector and taking note how quickly things have changed positively, which is absolutely fantastic for care to be the trailblazers on this. Apologies to my health colleagues who are on the call. Next slide, please. And really, this slide is just about all pulling in the right direction. For the good of people. As Steph outlined, when you're accessing services, let's make sure that the information is available, is consistent, is relevant. And if everybody is pulling in the same direction, we'll get there. We've got legislation coming in under the form of the data bill in spring this year. That will really push things along, and it's an important lever, and there will be penalties for those IT solutions that don't comply with that legislation. But it's not the only lever, and we shouldn't wait to get to those penalties. We should all be moving in the same direction at the same time, and then we'll get there. And that's it. Thank you, Katie.
Thanks, Becky. That was so helpful. Really, really informative. Before you go, I know I said we'd wait till the end for questions, but I'm going to just change things up as chair's prerogative here. There's a question in the Q&A from Abby Oakley, which I think is probably one for you specifically, which is, if you built your own record management / care planning system, is it still possible to work with PRSB to obtain a compliance certificate to go through conformance?
Yeah, absolutely. And we've done that already. And we'd love to support you, to be perfectly honest. So please do get in touch. And it's me who would work with you through that with our assessor team. And yeah, and the same goes for anybody who is creating their own solution. That's absolutely fine. And we're here to support you.
That's great news. We'll make sure that your contact details get sent to everybody after this as well. Brilliant. And so without any further ado, we'll hand over to Alison Taylor from the Digitising Social Care team. We're going to do a switch over. So Alison's going to run her own slides today. So bear with us while we get that sorted. While Alison's getting those up, I just wanted to confirm, as Becky said, there is funding available for digital social care record solutions on the Assured Solutions list. Within the slide deck later on, I have a link to that funding material, so that will be going out to you. Right, so Alison, I can see it, but it's not in full presentation view, so I don't know if you wanted to push it into that.
Yes. Happening?
Just loading for me. Perfect. Thank you so much, and over to you.
Great, good to go. Thank you, Katie, and thank you, Rebecca. That time went really quickly. It's very unusual that I have time to sit and actually listen, and it's really great to sit and listen to other people. I think a lot of people have touched base on the heart of why I'm here. My name's Alison. I'm the Digital Social Care Record Senior Program Manager, one of many across the team. I am a nurse. And for 20 odd years, I've worked in digital across different programs across health and social care. Never dreamed a couple of years ago I'd be entering this world, to be honest, of standards and regulations. But I'm just going to try and give you a quick summary and overview of what's going on in my world, really. So what's DISC? DISC is this. It's several areas working together, as Becky said, to try and make sharing more accessible and more available information. I'm just going to concentrate on the digital social care records part in that bottom left-hand corner, because we haven't got time to go into everything else, quite honestly, and it's not my area of expertise. So why am I here? I'm here because policy that supports this sharing is the Care Data Matters. Not sure if any of you have read this document. It's huge, so I'd be surprised if you've read it back to back. However, it is a good source of information. The exec summary is particularly good. And as I've said in that slide, the two high-level principles around data and sharing it once, collecting it once, and reducing the burden for everybody. Let's be honest, we're all part of a system, and we can all do with some reducing of burden, and sharing this data and people not having to repeat themselves 20 times would be fantastic. And lived experience wise, I was out on a shift on Friday in a care home, and the reality out there for what we're doing is so needed, and it reminds me every day why I do this job in NHS England, as well as maintaining my registration as a nurse, to bring those powerful things back to say why we're doing it, really, and improve my life. When I'm out as a nurse, I want my life improved as well, as much as giving patient care or person-centered care. So my team, we're called Standards and the Regulation team. Sometimes we get it called interoperability. It just depends what the understanding out there is, really, and who comes on these calls. But we support the adoption, basically, of digital social care technology, creating new standards where we can, and adopting other standards that are in place, as PRSB and Becky has said, to do it once and share it many times, so that we're not duplicating work, we're all travelling in the same direction and working together. As a programme, we publish standards, and again, Rebecca talked about them before, of the conformance. We tend to use the word compliance, means the same thing. Suppliers are still having to submit evidence to make sure that they pass the test, get that tick in the box, and get their pretty certificate that they can share with everybody and say that they've done that standard. Our published standards are all in this slide deck that's going to be shared. So if you want to go off and click these links that I've shared, please do go ahead. If you've got any questions, please come back. We obviously work with a broad range of stakeholders, strategically, from top down, bottom up. That's how we can do things, and then meet in the middle. And I feel like I'm the meet in the middle girl, to bring that all together. It's like Becky said, we're leading the way, which is quite exciting, because 2.5 years ago, when I come to this space, I was really like, where do we start? I really didn't know where to start, and obviously working with different organisations, the PRSB, the suppliers, has brought this work together. The other thing to just snip on is the market assurance and the assurance we do our side. Obviously, Becky calls it conformance. It's the same thing, but we've got our own process under our framework in NHS England that assures other standards that are not PRSB, for example. So we've got data migration standards, information governance, and the list goes on. If you're interested in the whole suite of standards, again, please do click on the links and have a look. And the last link on there is some comms around the data standards and what we're doing. It's a page on the Digital Social Care website that Katie knows all about and has supported us from the beginning with this work. And it really does set it out in plain English because it can be a complicated world and we need to get this knowledge and information out there. So do please have a look. So what is a DSCR and how does it link with mods? So we've spoken about digital social care records and I'm sure you guys know what it is, but in case you don't, they're for recording person-centred information. And our programme was set up and the initiation was the desire to get rid of paper. And I think we've always got that desire. I think working across health and social care, we've been working towards paper light for many years. That's a term that I've had. And I think in many areas we have got there. I really do. But it's not consistent. And obviously it varies completely across the country. We've got assured suppliers and the link's been shared. I see that coming past my screen of these assured solutions. Currently, we have 20 assured solutions on the supplier list, but it is a dynamic purchasing system. So suppliers come on, they come off, they conform to standards, they don't conform to standards, and it's a real live process that our market assurance team manage really effectively within our programme. And if you want to know anything more about that, please do reach out. So when implemented, the specific items in mods will be visible in the digital social care records for providers, and it's to use for recording the details of the person receiving care. And it's designed to be user-friendly and cloud-based and mobile first, which is all the things that we want to see in here with the digital social care records. So mods, as you'll hear it called, I think I've heard it called now for a good couple of years, but people are still new to it. So it's changed over the years, the S. It is now officially the minimum operational data standard, because to develop a standard, you go through several processes. And we've got to the stage where we've done the data set and the specification. So now it's a standard. And as Becky alluded to before, it will become an ISN in the next, I'm going to say few weeks, so I'm going to caveat myself. But there is a timeline on there for around end of April, but we're not sure if we're going to hit that target yet due to obviously what's going on currently in NHS England. But I'm positive we'll get over the line very soon. And we've gone through the Data Alliance Partnership Board, and we're right at the end of that for approval to proceed to the next stage. The mod standard describes the data that recorded by you guys, and I'm sure a lot of it you will recognise. As Becky said, a lot of the mods is based on, and we've used PRSB, Personalised Care and Support Standard, along with the core information standard as well. So a lot of this stuff you guys already capture, but we're doing it because we want to improve the quality and consistency of information. I think Becky covered an awful lot about that, of why we're doing it and what we're doing it for. And obviously we just want to record it once and share it many times. So I'm just going to reiterate that message in reducing the burden on care providers and freeing up that precious time to give back to care that we all want out there. So we're going to get a bit technical now, but I'm going to try not to be technical because I'm not technical at all. But through this work, obviously, I've learned an awful lot. Just bear with me, because what I'm going to do is I'm going to explain this slide and then I'm going to escape from this screen and go into the actual conceptual model and the knowledge base to actually show you what we've developed, because that's how I learn. A lot of people learn like that. And obviously, if you don't, there's a few slides in the deck that will be shared that you can go through and click on in that way. Depends how you learn. So, but to present it to you, I just find it's an easier way if you're not technical, just to see what we've done. So the conceptual model, this is in the background, basically how systems are developed and standards are developed And for the first time, we've actually got an adult social care conceptual model for, I don't know, I've got stuck there, haven't I? It's a conceptual model for creating standards to make sure that we're all doing the same thing. And as you can see on there, I don't think there's anything there that anybody wouldn't have heard about. The language is very different. Obviously, the subject of care is the person receiving care, but nobody gets to see that. This is all that back end that's in the data catalogue. So I'm going to escape out of here and go into our knowledge base. So we've created this knowledge base around the DISC program, around standards, the data catalogue that holds these standards, and the conceptual model behind it. As you can see, if you navigate on the left-hand side, there is so much information here. It really would be information overload if I took you through that, but it's here for you to browse and come back with any questions that you may have. So just looking at the conceptual model, as you can see, each section is broken down into the category types, and all this feeds back to the standard and the specification that's been developed for the mods. So when I talk about mods, this is the data catalogue. As you can see, if people have been on the Digital Social Care website, it's branded the same, looks the same, and the look and feel is very much what hopefully people are looking at. It's brand new, we're learning all the time, taking feedback, and it's taken a good 2 years of consultation with lots of stakeholders to get where we are. So when I talk about mods, this is the catalogue that you can see at the top. There's lots of navigation stuff to mods directly at the top. So if you wanted to go and see the data standard or the conceptual model or the guidance, which then takes you back to the knowledge base, it's all there. So you can access it, what's it called? The bi-directional, basically. Wherever you are, it should take you backwards and forwards, depending on how you like to view stuff. So going into the actual data, this is how it looks. And for me, it's not the view that I would use. This tool isn't for me. This is more for developers, for sharing, for getting this information. But if people are on the call that are technical and want to go into this to more detail, we can give specific demos of this system if that's what you need. But as you can see, down the left-hand side is all the headings that you saw in the conceptual model. And as you open these out, they consistently drill down into the metadata. And it's huge. It really is. And you can see all the data classes, the data elements, the relationships, where it goes back to in the specification, whether it's a must do or a should or a could or a maybe for the suppliers. And it's really, really detailed. So I just think that gives a better view for you than me putting it on a slide. But I will go back to this one here, which is again on our knowledge base. These are the requirements and use cases that we built this whole thing on. And as you can see, there's a scenario there that brings it to life around consistency of care and recording across an MDT, which I'm sure you've all had experience of. Even if you haven't in your job, I'm sure as a personal experience, you've had this as a carer or a concerned relative trying to bring care together. So none of it will surprise you that the scenario, Mrs. Smith, who is our subject of care, and if you actually click on the subject of care, it's that clever that it takes you through to the catalogue, takes you straight to the data class and tells you where the subject of care is in a technical format and all the relationships that are used to build in a specification. That's about as how far I can go technically. So if you want to know any more about that, please get in touch. Happy to get experts to reach out. But as this was a non-technical call, that's an overview of the technology that we've built. And the scenario, as you can see, Mrs. Smith lives alone and she needs assistance with dressing, personal care. And what we've done is mapped out every single data element item in the conceptual model and where it would sit in the minimum operational data set for care providers to record this information. I'm not going to go through it line by line. It is really quite heavy, and please do go through it in your own time. The scenario really won't surprise you, and the hope is that we make this better, you know, so that Mrs. Smith doesn't miss a medication. The A&E doctor gets to know that she's got that dementia so that she might not be accurate of medications, and all those sort of risk management stuff that we have every day when we're looking after people without having the information available. And I've probably talked through the goal there because it's to support Mrs. Smith to live there with no risk and issues. And the assumptions is also broken down in the process. So it's quite detailed. And if you want to go into this, please feel free and get in touch with the team. I now need to navigate my way back to the presentation to see where I am. So I've just showed you the catalogue. So why did we do it? I think I've covered a lot of this. It's a central place for the standards. It's the first place. Health haven't got one of these yet. We are the trailblazers, as Becky said, of being able to find social care definitions, terminology, and contribute to some standards development and share the knowledge in that area that everybody needs to share. It's working in the open, developing new standards, and obviously learning our lessons from the things that we need to learn from. I think I've covered the next slides around consistency of recording. We know who's involved and we want to share it. We want to record it once and share it many times. These are the slides that I've said that I've literally copied and pasted for you guys in the slide deck that you can go through that you want to with that tool and the case study. And I'll just leave them there. They are very heavy, which is why I didn't want to present in that way and thought it was more effective to go out to the tool and have a look that way. So just going to take you back to the assurance within NHS England. I mentioned before for the ISM process, the Data Alliance Partnership Board is the governing process that signs off the information standard notifications. And these are all the 9 lenses that both us, PRSB, and anybody that's creating or developing standards goes through to actually get that information standard notification that's be able to be implemented by IT solution suppliers. I'm going to skip down to this next slide because this is much better pictorial vision of where we've been over the last couple of years. We're at the second to the end box. We're coming up to May 24. April 24 is when we're hoping to release the ISN with approval. As I say, that may be running a little bit late because we need to get through some other assurance processes. And the DSCR roadmap publication, we're looking at May. And again, that might move out to June because there's so much going on in our supplier world at the moment that, considering the burden, that will probably move out so that we can give some breathing space, discuss with them and see where that's appropriate. Because that's our process. We discuss with our suppliers, we engage with them. We've got a market governance group and a roadmap management group that governs all this work. And then we're aiming for an August 25 compliance date for our solution suppliers. Again, if dates move out, that would move out as well. So this is just a high level of what we're working to as of today. I think the slide I skipped was just to give you information around the level of engagement we've done, which I think we've covered. We've got speakers on here, and it just gives you an overview and a reminder slide of who we have engaged with around this programme. And I think my last slide is just to let you know what's coming. After mods, we are going to attempt to do a reporting in a data set, and it is different completely from the direct care mods standard that we've developed. This is going to be around secondary use and all different stakeholders that are going to use this. So I know that my life is going to be a little bit harder, although I have learnt lots of lessons doing it with the mods. And you can see on that slide where we're going with the RMDS, and it's all around reducing burden. We know you capture so much data at the moment, capacity tracker, PRR, returns, etc. And we want to look at all that. We are looking at all that. I think we've looked at it now for 2 years as well. It's just behind the mods. And now this is coming to the forefront to work with DHSC and really define what we want to do, what we've got, and what the way forward is. And again, we'll back it up with comms that will look very similar to the mods page, because we'll just start adding to there as we develop stuff so that we share the information all the time and it's up to date. And working with Steph and colleagues on this call, Steph very much takes it out onto social media and all the platforms that it needs to be shared so that everybody knows about this work. And I think that is me.
Wonderful. Thank you, Alison. That was a very thorough run through of the minimum operational data standard, and also great to sort of understand what's going to be coming a little bit further down the line. I have put a link at the end of this presentation to the newsletter sign-up form for Digitising Social Care. If people want to make sure they're not missing any updates, especially around sort of the reporting minimum data set and what's data standard. Sorry, I need to get used to the new terminology there. Then please do sign up for that newsletter, and all of the information is compiled by Steph Nimmo very ably and put into there, so you won't miss anything at all. Right, I can see there's questions coming through. We will get to those at the end, but without any further ado, I'd like to pass over to Taffy Gatawa from Casper to talk about implementing standards from a software supplier's perspective. Taffy, over to you.
Thank you, Katie, and good afternoon to you all. My name is Taffy, as Katie has said, and I'm one of the board members for Casper. And so I'm really delighted to be here to talk about implementing standards and to kind of give an overview of the supplier journey and some of the insights we've drawn from going through that process that you've heard mentioned already, and share some of those insights with you all. Thanks, Katie. So I'm going to I'll start by just giving you a brief overview of Casper. Hopefully there are some Casper members on the call and some software suppliers as well. So I'll talk a bit about Casper before going into why standards, and then just sharing some of those insights around when we've seen it work well, what are those ingredients for that success playbook for implementing standards, share a bit about the real world experience of what that's like to go through that process that we've heard referenced quite a few times already on the call, and then just speak to the benefits. Again, we've heard a lot already on those benefits, but again, just kind of summarizing, even from a supply perspective, what are the benefits, and then just round that off. So Casper, who are we? So Casper was founded in March 2019, so we're nearly 5 years old. And Casper represents care software suppliers. So really those software suppliers who are working within social care, mostly exclusively, but we do have some that also work across health. And we now have just under 50 members, and our members are software agnostics. And that's one of the strengths that we see for Casper, that our membership really does represent the diversity in terms of care tech that's in use today. And what that does is it allows us to have an understanding of the various technology that's in use and how people are using it, where they're using it, and also helps to surface from a standards perspective, as well as, other issues around different tech that is being used across the sector. Thank you, Katie. So really, when we began, we were very clear on what we saw as an opportunity for better cohesion among software suppliers. And that was really part of our starting point. We felt that there was a lot of software suppliers working in the space, all doing slightly different things, all trying to make a difference, but we weren't really cohesive in how we were doing that. And we felt that we weren't always successful in being able to engage with policymakers and other relevant stakeholders who kind of influenced how we were working. And so from that, the idea of Casper was born, which was really to try and bring us all together, regardless of the type of technology we were offering, and to be able to engage cohesively with the sector, with policymakers, given that we'd all chosen to operate in this sector. And we had a number of things that we identified as being priorities for us when we started. And you can see these reflected in our objectives. And one of those was around how do we promote more use of digital technologies to improve quality of care. Back in 2019, we were thinking about this. And we also were already starting to see, either through our own customer bases that we were providing and partnerships that we had, that there was a real challenge sometimes in terms of enabling the flow of information. And we were seeing that played out in some of the avoidable harm that would be reported through our systems. And so we wanted to start to look at this from a supplier perspective and think about what can we do to contribute to make this better? Because our customers were telling us that this is important. It's something that they wanted to do, but they didn't always have the right stakeholders or certainly the software suppliers at the table to be able to have a conversation around how do we make this possible. We were also very aware that because we were a disparate group of suppliers, we were all operating slightly differently, albeit we all wanted to do the right thing. We all wanted to make things better for our customers, for the sector. And one of the things we wanted to begin to explore, and that we thought Casper would give us the opportunity to do, was to set standards where those didn't exist. And I know today we're talking about information standards, but we were also concerned about best practice amongst software suppliers. What did that look like? And since we started, we've done a number of events and put out some white papers to reflect what we see as best practice across different areas. So the latest one I can think of is a cyber awareness event that we held, and Katie was one of our speakers because we recognize that this is important. And through Casper, we have the opportunity of sharing best practice around a number of these important areas. Next slide, please, Katie. And so since we started, some of the notable work that we've done has been our engagement with what was NHSX back then, and how that through that engagement we were able to work together to bring about the dynamic purchasing system that we've already had spoken today. So I mentioned earlier that Casper was founded in 2019. In fact, it was March 2019. So we are 5 years old tomorrow. And had we known then that a year from then we would be in a very different place facing a pandemic, and having started Casper in March of the 2019, roll forward a year and we found ourselves in this situation where we had a global pandemic, and having information, current information, was a real imperative for the nation as a whole. As Casper, we came together working with NHS Digital at the time, and we began to think about what could Casper do, what could software suppliers do to help with that information, so that decision makers would have current information that they could base their decisions upon. And so we did a piece of work which enabled us to share some data to show incidents of COVID in social care at a time when there wasn't really a lot of that information coming through. So we were able to provide a daily report, which then fed into the SITREP meetings that were happening at the centre to help understand how that was playing out within social care. And that was a pivotal piece of work, because I think it really opened up for people the potential of what more could be done in terms of information sharing, but also highlighted the wealth of information that was being captured within digital social care record. So that was a useful exercise that we undertook, proof of concept. I think there is a write-up of that somewhere on the NHS websites for that, if people are interested in understanding a bit of that work. But that really opened up the opportunity and discussions around where else could we take data sharing, what else could we do, and that led to other interesting data sharing initiatives between Casper and NHS Digital at the time, notably GP Connect, which saw for the first time GP records being shared with social care providers. And we've seen so many of the benefits of that in terms of time saving, better quality of care, timely reconciliation of medication issues, and so on and so forth. Another thing that we were very keen to do, because it completely aligned with our thinking, our strategies at the beginning, was really about the standards, which I talked about earlier on. And so as independent members of CASPER, a lot of our members were already partners for PRSB and had already done a bit of work around standards. And so again, this represented an opportunity of kind of bringing all of that together and work more closely with organizations such as PRSB, digital social care, etc. Next slide, please, Katie. And so for us, the case for implementing standards had already been made because it was very much part of our thinking when we started. Because we had that diversity across our membership and our supply market, it made sense to have this framework, because what we'd observed was, either from talking to our membership or from talking to care providers, there was often a willingness to have more data sharing, a willingness to integrate. And certainly where people were using a range of system, a constant that we were hearing was, it would be so good if we could share information between these two systems, because either we wouldn't have to enter the information twice in the different systems that we use, or we wouldn't have to keep repeating. So again, when conversations around a framework for standards, starting to think about the DPS and what that would mean in terms of bringing about alignment in terms of information standards, all of that very much chimed with CASPER as an organization, our objectives, and some of what we were trying to push. So suddenly we had collaborators, partners that we could jointly drive a shared vision around how we integrate. We were very aware starting that there was variance in exposure to standards for sharing information, how those were implemented, and indeed how those were adopted, and also resourcing requirements. But by having that framework to have the conversation with other stakeholders, these were all things that we could work through in terms of how do we put a governance framework around that, and what support do we need, what resources do we need to be thinking about, and that how do we manage that in terms of prioritizing implementing those standards, as well as individual companies' roadmaps and other priorities. But we were also clear that as well as the benefits that we were talking about in terms of the national ambition and digitizing social care, that there would be benefits for suppliers in terms of helping to achieve economies of scale, and all of those things, and standardizing in terms of sharing information. So again, it all felt like this was not pushing against a closed door, and very much what we were keen to do as an association. Next slide, please, Katie. And so when we talked about this, as I said before, some of us had already ventured into implementing standards, and we'd seen what were the things that had contributed to the success when we previously embarked on implementing standards. And that's a bit of what I wanted to share today. And what was clear, if I think about the work that we did around GP Connect, for example, there was a real shared vision about what it is we wanted to achieve, both from the supplier's perspective, but also from the center when we came together to talk about that as an opportunity. And that really helped to keep the momentum and to make sure that there was a clarity in terms of what we're trying to achieve and how we're going to do to go about it. There were things that came up along the way, but because we had that shared vision, we kept coming back to that, and it meant that we could work through issues as they arose to keep going and maintain that momentum to see that to completion. Early engagement with suppliers, I would say, is really key. And so I'm really pleased that, as Alison said, there is already now an inbuilt framework that allows for that engagement with suppliers, which means suppliers can contribute and share their thoughts, and we can test that out. It also means that from the centre's perspective, there is that opportunity to test readiness, capability. I mean, as Alison already mentioned there, that dependable upon, the pace and scale, things sometimes might need to flex. And that's really welcome and a really useful way of progressing the important work around standards. I think having the right incentives for all stakeholders is important. And I'm really pleased about this session today, because previously I've talked about a disconnect where suppliers are talking about standards, they're implementing standards, and perhaps the message hasn't quite filtered in the same way, or there's been different engagement with care providers. And so customers are saying, well, why are you changing that? Why we like the way it was. And so it's really good to see that all coming together with the same sort of message going out to suppliers and providers, because for sure, some of this work means that we have to change the way in which products are configured or how they work. And that means retraining customers. But if they understand why it is those changes have been brought about, and it's the same priority that they're working to, then it just makes that more seamless a process. So joining up that message is really important, building up incrementally, and just, I suppose, recognizing that even after you've implemented the standards, and I think this is true for our own journey with some of the standards that Becky has spoken and referenced today about me and the personalized care and support plan, it can take time for those to be adopted for various reasons. And so from a supplier perspective, where you're constantly having to weigh your priorities, you're operating in a competitive environment, it can feel, well, why are we doing this if nobody wants it? So again, having that shared joint message, but also just understanding that that's the reality. It will take time for those to be adopted, but that is happening, and we can see all of the activity that's aligned to supporting that adoption. Next slide, please, Katie. And so I thought I would share a bit. We've heard about the conformance process reference. We've heard about the assured suppliers list and the number of suppliers that are on there. So I thought I would spend just a bit of time talking about what that is really like. So hopefully for suppliers on the call, if you're going through that process or are contemplating going through that process, then you might be able to relate to some of what I'm about to share. So if we think about it, starting from you make that decision, you've decided you want to go and apply to be on that solutions, assured solutions list. So there's a process to go through and lots of documentation that you need to complete, and that is your starting point. But one of the key parts of that process is this commitment that you will implement the standards. That's a really important part of that. So from the outset, you're committing that to be on that list, you are going to implement the standards as set out. And certainly from a personal experience and also from talking to CASPA members, I think it's true to say that more often than not, people always underestimate how long it will take, how much time it will take, and other costs that may not be financial, but just how long that process will take. And that's because you have to iterate when you start on that journey. I talked earlier about you might need to change things, you might need to go back and clarify things, you might have discussions about, well, why that way and not that way. So it's a lengthy process. So you need to allow time for that. You need to factor that in amongst the rest of your priorities. And I think doing that in a timely way is important. So thinking about certainly PRSB information standards, for example, the conformance for that is slightly different to the conformance for the other DISC standards. So allowing times that you've booked your appointments to do that review that Becky spoke about is really important, because then you can map out what you're doing. You've planned that in time, and you're not going to run out of time. So that's really important. But just also acknowledging that, this can take time. Getting compliance is slow. It's not a linear process. There is back and forth. And to be prepared to make those changes to the product and to retrain your customers, the end users. But ultimately, as we've heard before, what you end up with is, if you take the time to go through it, you will end up with something that we know is really going to help deliver those impacts, so that ultimately the people who are being supported with your software can get the best possible care. Next slide, please, Katie. So I won't labor the points in terms of benefits. We've already heard both from Steph and Becky talk about those around just the better outcomes, quality of care for people who are being supported with the software, but also these benefits. I think I talked earlier about, the right incentives for different stakeholders. So we've got the quality of care for the people who are receiving care, absolutely crucial to what we're all doing here, but also reducing the burden from providers. If we have standards, it means people don't have to implement or enter information multiple times. That's going to reduce the burden and free up people to really do the core of their roles, which is supporting those people. From a software supplier point of view, you've got the benefit of having a system that's compliant. It means once you've implemented those standards, it's much easier to scale. So again, there's benefits on both sides. From a national perspective, we've heard about, the opportunities for data sharing in terms of how we can really transform the sector, how we can work better with our health colleagues as we move forward through digitization. So loads of benefits across different stakeholders. And I talked a little bit earlier about the aggregation data exercise that we did and the opportunity there. And I think as more and more providers adopt digital solutions, and those solutions that they adopt are compliant and are implementing standards, there's a real opportunity at a national level to do more with that data, all being governed under a compliant framework to really deliver those good outcomes across the piece. Next slide, please, Katie. So I guess in summary, really, I think what I wanted to really share here was, whilst we're talking about navigating standards, etc., it's something that's really aligned to the goals of CASPA and actually was very much part of the thinking from the very beginning. We're very keen to support members going through this process, but also to continue that wider collaboration with stakeholders like NHS, Katie and her team, because that's where we see the real success. We're not always going to see things eye to eye. There's always going to be a bit of back and forth sometimes, but if we've got that framework where we can have those discussions and we can negotiate and we can talk, then, I think we're in a good place to deliver success as far as implementing standards. We've talked a bit about the benefits to the sector, to suppliers and to care receivers. And ultimately, I think from a supplier perspective, one of the key things is, as well as having a compliant system, it really does become easy to scale. Becky showed a slide that showed a shared care record. I think what the standards do means that if we can get to a place where we have one way of connecting to a shared care record rather than 42 ways, therein lies the opportunity, even from a supplier perspective. So thank you very much for inviting me to contribute to what I think is a really important session. And thank you for listening.
Thank you so much, Kathy. That was really, really helpful. I think it's just really important to understand that this is something that software suppliers are also working towards. I hear quite a lot from care providers who are quite concerned that this is something they're really going to have to fight with their software suppliers with. It's very much not, is the message. And I think that's just been really, really helpful. So we now are going to move to our Q&A section. We've got some questions which have come through already, but if you do have any questions for the panel, please do continue to bring those through. If I could ask everybody to turn your cameras back on, if possible, and we will get started. Okay, lovely to see your faces again. So we'll start off with a question from Tejinder. Oh, hi, TJ. TJ asks, once the supplier is listed on the assured solution list, is there any incentive for them to integrate with GP Connect or other health records? I don't know, Becky and Alison, maybe if one of you wanted to take that about sort of the GP Connect process.
Yeah, GP Connect is part of our standards when you come to bid to be on the assured suppliers list. So there's no cost to the care providers. It's part of that initial implementation. So your solution, if they're not currently assured, if they were, would get GP Connect.
Great, thank you. Is there anything you wanted to add there, Becky?
No, that was answered beautifully, Alison. Far more knowledgeable than I would have done.
And actually, probably as a follow-up from that, just because I don't know if everybody on the call will be aware of GP Connect and exactly what it is. Taffy, I know Casper wrote a white paper on GP Connect. I popped the link in the chat. I don't know if you could maybe just talk a little bit about GP Connect and what's happening there.
Yes, certainly. So GP Connect allows for the GP patient record to be accessed just using a static view, so no changes, but allows for that to be accessed by care providers. There is a compliance process to go through that. So from a supplier perspective, you have to go through a compliance process for your system to be able to enable those records to pull through your system. So that's looking at a technical conformance as well as some elements around clinical safety. From a provider point of view, you then have to sign up to, there's a national data sharing agreement, which just sets out the governance from a provider perspective. So there was a big piece of work done. So I think I mentioned earlier that when we did the piece of work, it was the first time that those records were being shared with social care providers. So up until that point, GP Connect was only accessible within health. That information wasn't being shared within social care. And initially, when we first implemented that as part of Casper, we could only enable access to clinicians or registered clinicians working within social care. So that meant if you had physiotherapists or registered nurses, only those people could access those records in social care. And what we very quickly realized was that actually it was a limitation because the profile of the workforce is very different. And actually the people who need that access aren't always registered clinicians. So Alison is nodding. I think she is recalling the conversations that we had to broker and the piece of work we did to engage with the ICO, so the Information Commissioner, to make sure that the ask and what we were proposing was all in line with the regulation. We engaged with the GPs, so the Royal College of General Practitioners, as the data controllers of that information, again, to set out the parameters under which the data would be shared and the governance that we were going to put around that. Similarly, we engaged with the National Data Guardian, and I'm sure most of you on the call will be aware that the National Guardian is the one who really has the interests of how patient information is used. So we consulted with them to get their perspective on was this appropriate and proportionate and what patients would expect in terms of their data sharing. And the reason I sort of labor all of those activities that led to that information being shared is that I think there is still, for some providers, a level of anxiety as to are we able to share these GP records? So it's really just to give you the assurance that we went through all of the necessary processes to make sure that that is legal sharing, and there continues to be a framework that monitors that this is all being done appropriately. So providers have to have completed the data security and protection toolkit to show that they know how to, they've got good practice around information standards. And what followed after that, once we realized the limitation of having clinicians only having access to that, were conversations about, well, the profile of the workforce is different. Could we look at giving perhaps a slightly reduced view, but looking at the core things? So, medication, a summary. We don't need all of the medical history and all of that, but certainly the medication, because what we know is that we're managing medication daily in social care. So we need access to that. We need access to current information about people's medication. We want to know when people have been to the GP and maybe we need to do something different in terms of the care that we're providing. So can we have maybe access to maybe the last 3 encounters with the GP, for example? So we did a piece of work around that and finally lobbied, wrote letters, had meetings, and got to a point where we could have social care professionals, not registered clinicians, having access to that slightly reduced view of information. So you can get allergies, you can get that medication information. So it's completely proportionate to the nature of the work in terms of how we're supporting people within social care. So that's available, and there's more suppliers that are going through that process, but hopefully that gives an outline of what that information is that you can access through GPs, and the assurance that when your supplier says they can give this to you, they're not doing that in a nefarious way. They've gone through all of the necessary governance to enable those records to be shared.
Thank you, Taffy. That is really important to sort of reassure everybody on the call that a lot of governance has been gone through. I think I certainly first had a conversation, I think, in 2017 about access to a portion of the GP record for people working at that time just in care homes. It is broader now. So this has been a long multi-year process, which has happened since before Casper or Digital Care Hub even existed. So been a lot of steps and some great work from lots of people, including Alison and her team as well. We have had a question come through with somebody just wanting to clarify how a supplier has access to GP Connect. Is there a quick link or a web page that you could share, or contact details for somebody sort of to go through, or is it something which is quick to share now?
Yes, so there is a dedicated website for GP Connect, which will kind of set out the compliance process, but the various aspects of GP Connect that you can have. Most typically, it's what they call the access record HTML, which gives you the static view of the GP record. So there's loads of resources there. I can certainly share some links with Katie to go with the pack in terms of just some quick guides, just to give you an overview of the key things that you need to have in place if you're wanting to go on that journey to implement GP Connect.
That's brilliant. Thank you so much for that.
And I just leap in there, and I think Alison will confirm this. We have over 1,500 providers now using GP Connect, and we've been doing a lot of work measuring the benefits around DSCRs, and we're getting some really brilliant feedback on how it's now enabled them to have that 24/7 access to information, which then reduces risk because there's no delay. If there's been any change, there's no delay in changing a care regimen.
Thank you. On a slightly different note, I think we have a really important question here, which maybe follows on slightly from what Taffy was saying there, and also Steph. But we have a question from Claire, who works in a drug and alcohol rehab area, which is CQC registered. There's obviously a lot of stigma around sort of drug and alcohol rehab, and they work also within prison probation. So how will those incredibly sensitive records be protected or only seen by people who really need to? I know this is something that
I'm happy
with
pick
the
that up,
PRSB or Alison. Yeah, whichever way.
Role-based access control. That is the way that it's accessed. All the systems are built so that the right person at the right time gets the right information, and there's a massive governance process behind that the suppliers implement and develop to make sure that's right, working correctly. And it's very much the basis behind the IG sharing nationally. Most systems have a role-based access control system, and we did all that and mapped all that with the work that we've done over the last few years, and I'm sure there's more you can add to that, Taffy, from a supplier perspective around that. But at a very quick high level, role-based access control is how we ensure, but we ensure that the right people get the right access to the right information, be that confidential or not.
That's right. And just to talk about it from a technical standpoint, so one of the things we talked about is making sure that we engage with the GPs as data controllers. And it's so important with any data sharing that data controllers retain that controllership of that data. So one of the things that we do from a technical point of view is that there are sensitivity flags. So if there are flags on any information, that information wouldn't be shared unless there's a particular role or whatever that, but we've taken account of that in terms of the technical implementation for GP Connect. So you can be sure that any information that is sensitive and wouldn't be part of what people need to know on a day-to-day basis is flagged, and that information wouldn't flow.
Thank you both. And I would encourage anybody on the call who has got a particular interest in sort of the sensitivity of data and how that's being shared and who will see it, to please get involved in consultation around sort of the development of new information standards as they become available. We always need lots of sort of care organisations and people who use services to be involved in consultation to make sure that those sorts of issues are raised and heard, and we can work through them in a really sort of sensitive way. As consultations come up, I know the PRSB newsletter will have information, our own will as well, and also the Digitising Social Care So if you're a care organisation with concerns about this, there's lots of opportunities as well to make sure your voices are heard, and also the voices of the people you're supporting are heard in this. So we'll keep making sure that's happening. I know you have already answered this one in the Q&A written, Becky, but I'll just give you an opportunity to say it out loud as well. We had a question, if our IT department and CIO, Chief Information Officer, haven't heard of ISNs, is there one link I could share with them to grab their attention and get them engaged with the Information Standard Notice and Digitising Social Care roadmap?
Yeah, absolutely. So I have put a link on there. It's not the most exciting link in the world, but what it is the listing for the Information Standards Notice for the Personalised Care and Support Plan. So you can clearly see there which environments are mandated to implement that standard. What I would also say, though, if you're looking for something which is a bit more user-friendly, there are so many resources out there, not just from Katie's team and from Alison's team and from Casper. We've got lots of information on the PRSB website as well, and we'd also be happy to have a conversation with your team. I can send tailored slides out to you. What everybody on this call wants to do is make sure that the standards are known about and used and implemented. So there's loads of information out there. So I put the very dry one in the chat, but lots more resources out there as well.
Thank you so much for that, Becky. And if your CIO is somebody who responds better to the more emotional sort of side of it, there is a great blog which has recently been posted on the Digitising Social Care site, really talking about the sort of personal impact of data sharing, and kind of echoes a lot of the information that Steph brought in at the beginning about sort of the impact for individuals. So whichever way works for you, those resources are there. We've also had a question through, and we get this one all the time at Digital Care Hub. I'm sure all of you on the call do as well. So CQC, what's their role in all of this? I wonder, Steph, Nemo, if I could maybe come to you first, because I know you recently interviewed somebody from CQC to talk about how they feel about digital social care records.
Yeah, so I work really closely in my job with CQC, and they have issued guidance on the importance of good digital care planning and digital social care records, and they have publicly stated they support our programme of work. And their line is, it's for providers, it's going to be increasingly difficult to achieve a good or outstanding rating without good digital social care records. Clearly, they're not mandating, but if we just look at where the whole sector is going and what's happening, to be able to really deliver true person-centred care, that relies on good data being shared and exchanged. And if you go right back to paper, that's just not going to be possible. And as I said, just the stuff we're hearing now from providers who are using GP Connect, the benefits they're seeing in just more efficiencies, reducing risk, and just having faster and quicker access to care. It's all of that momentum of change that's happening that I know CQC recognise, the whole sector recognises, and it's a kind of just a direction that everyone's travelling on.
Thank you. I think that's been really helpful. I think CQC have been increasingly clear about how they feel about this. And there is, if you would like to see the interview that I mentioned, I'll pop the link into the email that we'll send out to everybody afterwards. But it's really, really good to sort of understand their sort of position. And it's was done by the Caring Few, interviewed by Mark Tops and organised by Steph and her team to kind of give a bit more detail around their position here. So sorry to be on a webinar and send you to another webinar, but there's a lot more info there. So I think we have, Amanda has called it a silly question. I actually think it's a really good question. There's no such thing as silly questions. Is the expectation that care record providers, digital social care record suppliers, will have to apply to both the PRSB approved list and the Digitising Social Care approved list? Are they the same thing, separate things? I don't know, Becky, if you want to come in on how that's working.
Yeah, absolutely. So if you're looking for an assured supplier, go to the DSCR list. Absolutely. If you are looking to understand which suppliers, and those are healthcare suppliers as well, have implemented the full range of PRSB standards. Have a look on the PRSB website. You'll see them clearly listed there. So they both can be used, but for assured suppliers, definitely go to the DSCR list. And I think that has already been put into the answers on the site. If not, I know Katie will share it afterwards.
Yeah, brilliant. Thank you for that. That was really helpful. Alison, did you want to add anything there? Or are you on that one?
I think from a supplier perspective, when you join the list, you have to comply to standards, and a couple of those standards are PRSB. So there's different assurance processes, but for a supplier, obviously they come on the assured supplier list and they would engage with PRSB because they want to be conformant with the standards, compliant, whatever word you choose to use.
Brilliant. Thank you. And I saw you did answer this written, but also just to, there was a question which came through Alison from somebody who's developing their own care management software system and was wondering if there's a deadline for when IT solutions can be added to the assured list.
No, currently we've got an active DPS, which is the dynamic purchasing system, which is where suppliers bid through. And at the moment, that's an open process and very agile. People come on, come off. It's a very massive area, and I'm sure Taffy will smile when, from a supplier's perspective, it's a lot of burden and a lot of work to get onto the assured supplier list. But all the benefits that come going through that pain, I believe in the future will outweigh what we're doing. And I think that's why Casper and the suppliers are on the journey, as well as PRSB.
Yeah, exactly. And that's why I think from Taffy's presentation about Casper and Becky's presentation about the PRSB, they're both also on hand to sort of help software suppliers with that process. And so please do get in touch with them. Contact details will be circulated with all of our participants today after this call. I think we have time for one more question, just conscious that people probably have other meetings to get to, and it's been quite a long one. I don't know, maybe Steph, if this is one for you from a sort of comms perspective, but we had a question about how would a care organisation know if their software supplier came off the assured list? Is there sort of a notification they would get?
At this point, no. If they're with an existing supplier, they will still have been assured. So unless that supplier suddenly decides to not offer a whole wad of functionality, and then you've got to ask the question why, they will continue to have been assured in the way they did, but no longer on our list. So we wouldn't alert providers because the issue is we will have assured them and then they've come off the list. I think the thing we do stress is that the list is dynamic. There are suppliers going on, there are suppliers coming off, so it's always worth to keep checking and keep an eye on what that list is and not just assume it's a static list.
And I just add to that and say, as a care provider working with a supplier, the communication is key and the relationship, because if your supplier is thinking about coming off the assured supplier list, doing anything different, they should be communicating with you as a basic need. So you may even be informing us that that's happening, because you may have that communication and then work through our implementation team, which is how we often get things that are happening out there very fast and we can't keep on top of everything. So it works both ways. I think it's definitely bi-directional and will always be that way, because of the vast scale that we all work at. But yeah, ask yourself as if you're. I would say ask the direct question. If you're worried about your supplier, go to them and ask them what their plan is. Ask them. You're more than entitled to go and ask them questions if you're worried about a supplier's position in the market or on the assured suppliers list, or any concerns that you've got with them, I would say. And I know Taffy would agree, just go directly to them with any concerns and escalate it through your customer service person, whoever they give you to do that liaison, and work that through to a resolution until you're happy.
And in fact, that's what we always say. I speak regularly to providers, and it's about that good relationship with your account manager and making sure you've got good service level agreement. And, you know, even down to, I don't understand how this works, or I'm not sure if I'm using all the functionality, they should be helping you with that so that you get the best benefit out of the system.
Great, thank you both. We really appreciate all of your time today. I just have another couple of slides I just want to quickly send people away with so they're aware of sort of where they can find information. We mentioned funding earlier. There is funding associated with the Assured Solutions. That information is on Steph and Alice's website, the Digitising Social Care website. These links will come out to you. If you're a care organisation and you haven't looked into that, please do have a look. And then finally, there's a bunch of resources and links which have been mentioned today. I will make sure that this slide is updated with the additional things that people have mentioned before it comes out to you. But all of those are publicly available resources. So I think all that is left is for me to say a huge, huge thank you to all of our speakers today. Thank you for sharing your expertise. Please do, if you've realised as somebody who's attended that you have more questions, get in touch with us. We'll be happy to follow up. So thank you for everybody and have a good rest of your day. Bye.
Thanks, everyone.
Thank you. Thanks, everyone.